Navigating postpartum depression, explaining and understanding the symptoms. Having a baby can be a major life transition. Bringing home a newborn can affect your sleep, routines, hormones, relationships, and more. All these changes can be stressful, and for some new parents, they may even lead to symptoms of depression. Hey there, I'm Sunny Williams, LPC, here with BetterHelp, and today I'll be talking to you about postpartum depression, or PPD. Postpartum depression can be a serious mental illness, but there are a lot of misconceptions about it out there. That's why in today's video, we'll be exploring what postpartum depression looks like, what symptoms to watch for, and what to do if you're experiencing any of these symptoms yourself. Let's dive in. What is postpartum depression? There are a lot of changes that can happen after giving birth to a child, some joyful and some challenging. It can be common for new parents to feel stressed or maybe even a little down. You might have even heard people use the term baby blues to talk about that slump you might feel in the first few weeks after having a baby. But for some parents, they experience more than the baby blues, a more intense and longer-lasting experience with symptoms that are closer to major depressive disorder or depression. This is called postpartum depression or PPD. Various studies estimate that up to 20% of parents experience PPD. Postpartum depression doesn't have a single exact cause. However, there are several factors that can make you more likely to develop PPD. Hormones are just one example. Pregnancy can cause changes in hormones like estrogen and progesterone, which can negatively affect mood and energy levels. Having a difficult pregnancy, trouble with fertility, or a history of mental illness may also raise the risk of PPD. But the cause of postpartum depression isn't always physical. Having a baby can profoundly change your lifestyle, social life, daily routines, and even your sense of self. These changes can sometimes feel overwhelming. That's why even parents who didn't physically give birth to their child can still experience PPD. Postpartum depression symptoms. Postpartum depression causes symptoms such as persistent sadness, trouble sleeping, and a loss of pleasure in hobbies and activities. These symptoms can start anytime during the first year after having a baby. Some people may notice symptoms immediately, but for others, symptoms don't start until a few months after giving birth. Other signs of postpartum depression may include anger, crying spells, changing in eating patterns, and feelings of emptiness, worthlessness, or hopelessness. You might have noticed that a lot of these symptoms are similar to the symptoms of depression, but there are other possible symptoms too. If you have postpartum depression, you might also experience negative thoughts, feelings, and behaviors related to parenthood. For example, you might have thoughts that being a parent isn't turning out how you expected it to, or that your child might be better off without you. You might also struggle to bond with your new child or have trouble looking after their needs. Treating postpartum depression. If you're struggling after having a baby, know that help is available. Therapy is often an effective treatment for PPD. Working with a therapist can give you space to explore your emotions and learn healthy coping strategies. Depending on your situation, your mental health care provider might also prescribe you medication to help improve your symptoms. But in addition to getting professional help, what else can you do to feel better? We'll go over some tips in a moment, but first, be sure to subscribe to the BetterHelp YouTube channel and turn on notifications so you don't miss out on our other mental health content. How to feel better. Aside from talking to a mental health professional, there are several other things you can do to manage PPD. If you haven't already, consider connecting with other parents. Talking to other people who understand your experience can help you learn new coping strategies and get social support. Try joining a local support group for new parents or parents with PPD. It can be tough to make time for social groups when you're a new parent, but even just an hour of support a week can be helpful for improving your mental health. If you can't attend a meetup in person, consider joining one online. Making the right lifestyle changes can also help put you on a path to feeling better. Try sitting down with your partner to discuss how you can split the responsibilities of taking care of your newborn. Do your best to eat a nutritious diet and consider setting up a regular exercise schedule to support your physical health. You might also find it helpful to take on a creative project like journaling or making a scrapbook about your new baby. It can be easy to skip these simple forms of self-care, but looking after your mental, physical, and emotional health isn't selfish or a waste of time. In fact, self-care can make it easier to manage the stresses of caring for a newborn. Postpartum depression can feel overwhelming, but thanks to treatments like therapy, medication, and lifestyle changes, recovery is possible. Don't forget to like this video if you found this information helpful, and subscribe to our channel for more mental health content. Until next time.